The healthcare sector is changing dramatically fast. That's why Maasstad Hospital in Rotterdam implemented a brand new IT architecture.
The hospital very much wants to work electronically at the new location, and for that, we really needed a new network to provide access to the electronic patient record, especially the accompanying image information, to have good support for the healthcare and healthcare chain as well.
Maasstad Hospital made a supplier shortlist, and after evaluation, Cisco emerged as the best candidate. Because the migration was a complicated process, the hospital asked Cisco partner Vosko for support and to help determine the needs.
Our knowledge and experience of hospital environments came in very handy here. After all, we had to design and build a very reliable solution for voice and data in a very short time. And this for very specific hospital applications, such as patient monitoring, nurse call, and building management systems.
Another reason for choosing Cisco was the Cisco capital formula.
In these times when investments are expensive, the financial lease option gave the Maasstad Hospital a very attractive way of financing the ICT infrastructure. Cisco Capital offered us a very attractive financing option. Maasstad Hospital is clearly a good example of how they looked at their core processes to further optimize them using ICT. It means that soon it will be possible to provide a patient who had their treatment here with aftercare, later in the healthcare institution, or perhaps even at home. So obviously, it has to be possible to have the patient data available anywhere in this chain. Cisco can offer a complete platform for the entire healthcare chain, so that this information on the patient concerned is available everywhere, and, as a result, it also becomes possible to do the aftercare using voice and video even in a home situation. This will help us to reduce costs and improve the quality of the healthcare. That is what we ultimately want in the Netherlands.
The solution is a redundant network infrastructure based on Cisco core and edge switches.
We have a computer on all the boxes, and the good thing about this is that you have a very complete picture of your patient. This means that you see your patient lying down, so you see the clinic, and you also have an idea of all the figures that go with this.
Also, all telephone calls have been switched to voice over IP.
You actually have direct contact, and this is obviously quite nice if you quickly need someone for a short time. What's more, it's extremely useful that it also has a list, so you can always look up someone just using the first name. So suppose I want to call my team leader, then if I don't know the number, I just enter his name and I can simply call him directly.
The new infrastructure also allows for computers on wheels used during patient rounds. Besides, the wireless network provides internet access for all patients and visitors. Patients now have a bedside terminal, allowing them to access care schedules, choose meals, download entertainment, and surf the net. The new infrastructure is also a great tool for the electronic patient dossier, or EPD.
The EPD allows us to see what's going on with our patient at any time, using any computer. We're much more accurately informed. We can monitor our patients continuously anywhere in the hospital. You can see laboratory results or X-rays like the ones displayed behind me, and that makes the quality of the healthcare considerably better. The commitment of Cisco and Vosko has resulted in a very reliable network that has been 100% available since it was put into operation for Maasstad. Clearly, this is vitally important for the hospital and has fully restored confidence in the technology.